I knew I wanted to be a doctor probably when I was about 9 years old. I wanted to be a meteorologist first, but once I got the bug of delivering babies and seeing children, I kind of wanted to do it all. But I always knew I had a Spanish medical dictionary that I got for Christmas when I was probably 13, and it just kind of solidified that that's what I wanted to do. I grew up in a poor farming community in southern Ohio, so my twin brother and I both decided to enlist in the Army National Guard. I was supposed to go to advanced training after I graduated high school, but I was accepted to West Point, and then I was part of the 2% that was selected to go to medical school. My first job out of the Army was actually right outside of post, so instead of seeing soldiers, I saw all their families. I love the newborn exams just because it's not just about, examining the infant, but it's also about educating the parents, especially those nervous first-time parents. I think the role of the primary care provider is similar to your routine auto mechanic. People often take better care of their cars than they do themselves. And so as a primary care physician, I think we're supposed to be in charge of that preventative maintenance for patients. So they should really come in so we could identify something early and hopefully treat it before it gets worse. The most rewarding part of my job as a family physician is being able to look at the patient smiling at you because they're happy to be there to see you. And so they trust you. And I feel like once you've honed in that patient-physician relationship and you've developed that trust, that's when it's the most rewarding because you'll see them forever.